favorite TV, advancing kingdom lifestyle.
Good evening, viewers. It's a great joy, once again to be here, Health Up, our great show where we talk about, wellness and where we are really bringing empowerment in matters, knowledge, attitudes, and skills where possible through this show that comes every evening. And we are glad that you're joining us even for today's show. Thank you so much. We trust that as we continue and as you have continued on, bringing up different forums and different guests discussing different matters, that this has actually empowered and changed our lives. And we are looking forward for more of this, and we are glad that we are here. Now, tonight, we're going to be discussing a very, pertinent matter. But before we do that, I just want to just mention that you have our guest tonight, Isaac Wahome, who is an audiologist, will be, coming back to that and looking what exactly do we mean by when you say an audiologist? Sounds a very, technical term, but you're going to be delving into that and breaking down these into smaller pieces that are, as we say, that are manageable. Right, and if you're just joining us, I would want us to just invite our friends. This is going to be live and is actually live on Facebook Live. We are also on Elevate TV website, and I believe also YouTube, and you're going to be having this. So if you're in the office and you have not yet, gone home or just caught the next matatu, this is the time, this is the opportunity. Don't miss this show. Karibu sana, and we are glad that you continue to interact with us. Also, there'll be a number that's going to be going down on your screen. You can use that to send comments, leave us your comments, your questions. Peradventure, you may be able to help us, within the context of this forum, or otherwise that can always be discussed. So we are glad that Karibu Sana. Isaac Wahome is, a clinician and with, several, trainings towards these matters. And when you talk about audiologists, maybe I could just, just take us through, the education or where, the professional background of our guest tonight. Isaac Wahome is one who has, done or been trained in clinical medicine and surgery, and also done, again, that postgraduate course again on ENT, what you call ear, nose, and throat. He has several other, qualifications. Just allow me to look at this, hearing instrument science, from Zambia. He has also been trained on hearing aids, audiology, Edinburgh, London, and also carried on a master in clinical audiology and hearing in Spain. And we are glad. This is, quite an experience and quite an exposure in different places, different nations and different platforms. And we are glad that you're joining us. And therefore, an audiologist, and he's going to be telling us, is one that is specialized in some of these matters that pertain, ear, nose, and throat, and especially the ear. So karibu sana. Maybe Isaac, you can just, introduce yourself. Tell us, what is and who is an audiologist as we just, begin this show, and you're going to be glad into that. And before he does that, today we're going to be discussing, our topic tonight is about hearing loss, and you're going to be looking at what is hearing loss, what are some of the causes, and delve in those matters. It's not quite a unique topic, but unique in certain matters. But you're going to be looking at all this. So, karibu sana, Isaac.
Thank you very much.
Yes.
I appreciate the opportunity that you've given to me this evening.
Yes.
Like you rightly said, I am Isaac Wahome, founder of Dexter Hearing Center, clinical audiologist. Basically, I've been gone through different ranks to reach where I am, and I thank God for that. And like you said, an audiologist is just a group of a team that manages everything to do with hearing loss or hearing issues, and also dizziness and vertigo issues. Mm-hmm. So this is a spectrum that involves a lot of things.
Wow.
But here in Kenya, so we have a team that manages basically ear problems.
Okay.
So we have the ENT surgeons, we have the ENT clinical officers, we have the ENT nurses. But when it comes to testing and rehabilitation, of everything to do with ear, mostly in terms of hearing and also dizziness. That is where the audiologists come in.
All right.
Yeah, so in terms of my training, I've gone through the basic medical courses. I've done hearing instrument sciences in Zambia. I've also done hearing aid audiologists at Queen Margaret University in Edinburgh, London, and currently undertaking clinical audiology and hearing therapy in Spain.
Wow.
So I'm glad that it's an area that is growing.
True.
There's a lot of need in this country for specialized hearing care services.
Right.
Yes.
Wow.
Yeah,
Wow.
yeah.
I think that's awesome, and we're glad to have you tonight.
Yeah.
Maybe one of the things our viewers won't probably understand. It's an area that we probably I don't say it's a bit new,
Yeah.
but it's not so loud
Yeah.
within the communities, and within the circles. It's not a specialization that you would really hear as often. Maybe one of the question is, why the passion? I mean, you've really gone through education system and tried to really microscope it on this small matter, and this I don't want to go small, but just there and delve on this and specialize on it.
Yeah.
Why the passion? I know why pushed you, who pushed you, what pushed you into this?
So I think one of the issue that arises
Yes.
is until you have a problem is when you realize
Wow.
how important it is how to solve those problems. And from many stories, even from my grandmother, I believe like hearing loss, we say it's common with age.
Yes.
You realize like my grandmother had hearing loss, and it was very difficult to get a hearing aid by that time.
Yes.
And the passion currently is after going through my ENT training, when I saw the dead ends when it comes to managing hearing loss, there's usually a push on how we can be able to resolve some of the problems, especially in pediatric age group.
Okay.
Children are really a big population in this country, especially in developing countries,
Wow.
in middle and developing countries, where it's a huge problem in terms of managing these children.
Wow.
And the passion, therefore, goes to how we can be able to help our people back in the community.
Yes.
Going back to educate our people, going back to resolve or treat the hearing loss that they have. Because, you get a person with a hearing loss and they don't know where to go next. They probably start from a pharmacy, and then the pharmacy will refer them to an ENT, and then an ENT will refer them. So there is a cascade of referral system.
Okay.
And what we do is, as audiologists, is take up issues that have gone through a cascade and try to solve that. But now what we are doing as we are educating more young people in universities and in their community, that they can directly come to the audiology clinics, get hearing tested, and treated for their hearing loss.
Wow.
Yes.
Wow. Wow.
Yeah.
That's quite something.
Yeah.
I think that's major, and I want to guess that you have had quite some success, over time and over the years,
Sure.
trying to manage and try to, sort out some of these. And like you said, some of these patients or individuals have been referred from one place to the other. We'll be getting into matters, how you are able to tell someone has hearing loss, because I think it's quite something.
Yeah.
So for someone to know whether they have hearing loss, it requires quite some skill.
Sure.
Whether for them to be able to identify that. But anyway, how big is this problem? What's that?
Yeah. So you realize like today being the World Hearing Day.
Wow.
Yeah. WHO has come up with very recent statistics, and the statistics have been going on. And looking at 2019, they are saying, which is quite a recent study, that up to 460 million people
460 million.
globally have hearing loss. And the number is increasingly becoming more, because they are saying by the time we reach 2050, we will be talking about 950. That is close to 1 billion people with hearing loss.
Wow.
And out of 466 million people who have hearing loss, 34 million are children. In other words, what in terms of statistics we are saying, out of a big number.
Yes.
Out of a big number.
That's quite a proportion. Yes.
I mean, like, this is a huge burden.
Exactly.
That has an influence with the economy. It has a big influence with the social economic aspect of individual. It has an impact up to the community level.
True.
even when you're talking about an individual,
Yes.
leave alone when you're talking about an individual problem.
True.
It is a global problem that needs to be addressed,
Yes.
and it needs to be addressed now.
Yes.
And you know, in the World Hearing Day, what we are saying is the WHO is recommending all the countries to join hands and release a World Hearing report so that the policy people can see the impact and address this issue. If you look at the recent statistics that was released when we did the census recently,
Yes.
you are saying hearing loss is the third leading disability in this country. So apart from eye blindness,
Yes.
apart from physical disability, then hearing loss comes in as the third leading cause of disability.
Yes.
And when you are having a disabling hearing loss, it means that you are not going to function normally like any other person.
Absolutely.
In terms of work, in
Yes.
terms of communicating, and all those issues.
Yes.
So it's really a big issue, and it has impacted every community around the world and here in Kenya. And we have seen aspects where we have maybe 1 out of every 10 has a hearing loss, between 1 and 2 has a hearing loss. So it's really a big issue in terms of impact, even at academics, because you look at children.
True.
Remember that hearing loss basically affects development and speech communication aspect.
Exactly.
So you see children that are attending school and they are not able to understand what the teacher is saying.
True.
It means that that child can be affected throughout her life or his life if that hearing loss is not addressed. So we are saying that hearing loss needs to be addressed and need to be addressed urgently and now. And we are trying to do a lot of education, public awareness, both at the community level and at the individual levels.
Yes.
And we really are thankful of Elevate TV because of being the champions of hearing care in this country. So I think you are leading in the front.
Wow.
And I hope even other media stations can follow up into the same issue.
Absolutely awesome.
Yeah.
Did you know that hearing loss is such a common problem? And today being World Hearing Day, I don't know whether you knew that. We are just delving on this matter about hearing loss and trying to look at all these circumstances that surround it. If you're just joining us, don't touch that dial. We are on Elevate TV Health App, and interact with us on any of our social media platforms as they are going down on your screen, and you're going to be happy and glad that you continue watching and we continue learning, more about this. Daktari, when you're saying that, because you just touched about the impacts, of hearing loss and some of the things that result from it, talking about economic impacts, talking about, how children gets affected. I was amazed by the statistics you're talking about when you talk about children and hearing loss. We'll soon be talking about how we are able to know that.
Okay.
But my question also is, so what are some of the social impacts of this matter?
Definitely. So you realize, for instance, if you have a hearing loss and you're working, I've seen, or we have had stories where, a boss will come and shout to a secretary.
Oh dear.
Or complain every time I talk to you, you don't answer, you don't answer, so they keep on probably being fired from one place to another. And the fact is that they don't understand when the boss, because most of the bosses sometimes they speak softly. So that aspect of being fired from one place to another because you can't be able to hear. The aspect of when you have hearing loss, because there's a very nice study that was done by a person called Kabler-Ross about grieving that is associated with hearing loss. So what they say is that hearing loss has like some stages. One of the stage of hearing loss, number one, is denial. So you realize that people who have hearing loss, they tend to deny that they have hearing loss. And then after that, they go into an aspect of anger. They become so angry because of the frustrations that they have. They can't be able to interact. They wonder why, they go in a place, for example, when you go in a church, and people are laughing, people are enjoying, and you can't be able to hear someone, you can't be able to hear people in a meeting, you become frustrated. And anger builds in and you become angry. And what happens is you go again into depression. So you're looking at this person who is progressing into that until a point where you accept your hearing loss. There's an impact around you, because what happens, you start isolating yourself. You start coming out and withdrawing yourself from other people. And the people are surrounding you. They also see that. They see you withdrawing when you're going out for meetings, even for church meeting. Once probably you are active and now you're not active, you're not going out.
True.
So what happens is that they start noticing you are withdrawing.
Yes.
So basically it affects them. Again, when you have hearing loss and you are talking to an individual,
True.
even at home, you
Yes.
tend to raise your TV up.
Yeah,
So it
exactly.
affects everybody. Basically, there's an impact at the family level, at the community level, and globally, and even a financial impact, because you have to talk about work,
Yes.
where you have to work,
Yes.
because I mean, this is communication issues. You have to talk about how to rehabilitate this person in terms of the cost of the hearing aid, the cost of the test, the cost of cochlear implants, and many other things. Yes, I think the impact is so huge.
The impact is
Yes,
huge.
yes.
The impact cannot be, underestimated. When you talk about work, someone just where they're working with, whether it's a boss or colleagues, and the person is also not able to express themselves because they're also not able to hear. And other than probably some of the causation for this,
Yes.
hearing loss per se
Yes,
may not give you pain. It's not
Yes.
something that
Definitely.
that provokes you from within
Yes.
to go and seek any health or medical advice. You just realize, or it just happens, that you're not able to respond, or you're not responding appropriately. Issues like you're bringing out issues of denial, self-esteem,
Yes.
and you're talking of loss of work.
Yeah.
We are basically saying it also affects productivity, even in the society, because when one person is moving from one job to the other, or probably from a job, and they want to look for something else as an alternative to do, to be able to make ends meet, what you have done is that you have lost some intangible costs
Yes.
within the company, and you also lost some, you've also gotten into issues of looking for other staff, be
Yes.
able to replace, you need to train them. So it's just one
It's a
thing
cycle.
rolling, it's a cycle, it's a
Yeah,
vicious
it's a cycle.
cycle
Yeah.
that will ultimately also affect development.
Sure.
What we would call sustainable development,
Yes.
what we call development in a nation, will
Yes.
basically be affected by these matters.
Yes.
Are there some of other impacts you probably want to raise?
Yeah.
Issues with hearing loss?
Like you said, you rightly said that hearing loss is basically a silent disability. There is no pain, there's no blood. And these people suffer in silence. They are withdrawn, they tend to have stigma issues, they tend to have fear within themselves. Because even going out, if you have hearing loss, you fear being hit by a motorcycle or a bicycle.
Exactly.
So, like you said, it's a silent disability. Somebody called Helen Keller says that actually hearing loss separates us from, hearing itself separates us from people.
That's true.
Unlike blindness, which separates us from things, hearing loss separates us from people.
Oh dear.
Yeah, so you realize that the impact that it has on an individual, even before we talk about a community, is a big loss.
My goodness. I know we don't have we have many more time. This is getting really interesting and informative. Okay, maybe let's go to we actually beginning to define, way after we just started. What exactly is hearing loss? Because we have not even said what is hearing loss. There is much to discuss about it. What is hearing loss? There's also another term that is basically used in the community.
Yes.
Deafness.
Yes.
So hearing loss, deafness, what are these?
Yeah. Before we dive in, actually, even about hearing loss,
All right.
it's just important just to talk about hearing.
Okay. All right.
Hearing is just a nice, fascinating, very complex, simple mechanism where sound travels from the ear. So what usually happens is that even if you read the Bible,
Yes.
In Proverbs 20, chapter 12,
Wow.
it talks about, God has made the eyes and the ears
Yes.
even. So what happens is that the outer parts of the ear, they collect sound. So this part, what we call the pinna, are the ones that basically collect sounds, and then they tunnel through the ear canal. From the ear canal, inside there's a very delicate membrane called the tympanic membrane
yes.
that basically vibrates to acoustic signals. And from there, we have very nice, tiny, very organized bones inside there that are called the ossicles, that basically now translate or convert that acoustic energy into a mechanical energy.
True.
And then from there, the mechanical energy, it is transmitted through a fluid, very well organized fluids chamber called the cochlea.
Wow.
And then from the cochlea, basically sound is transmitted through the nerve to the brain.
Right.
So in other words, what we say, the ears are basically mechanisms, or they are channels to the sound,
Right.
where sound travels through to the brain. We hear through the brain. That is something new, but we hear through the brain.
We hear through the brain.
Yes.
I thought the brain is for thinking. Okay, fine.
Yeah. So we
Whatever
hear through,
thinking is.
Yeah. So we hear through the brain. It is the brain that basically organizes information. It disseminates information and coordinates what you're supposed to do.
Okay.
So that is part of the brain. So when we talk about hearing loss, then hearing loss is any interference with transmission of sound from the outer part of the ear to the brain.
That's quite
so
something.
whatever causes that interruption is what we refer as hearing loss.
Hearing loss.
So what happens is that we have the WHO and other bodies have brought out a criteria of saying people who have hearing loss. For instance, when we say disabling hearing loss for adult, we say a level of 40 and above. We have especially for adults, we consider that as disabling hearing loss.
Okay.
In pediatric, it is a little bit lower. We start at 30. In children, we say at 30 is disabling hearing loss.
Disabling hearing loss.
So, and then hearing loss basically is classified into different degrees. So you can have hearing loss that is mild, you can have hearing loss that is moderate, you can have hearing loss that is severe, and you can have total hearing loss, what we call profound hearing loss. Sometimes moderate hearing loss accounts for majority of problems that we incur. And these are the people that when you talk to them, you have to repeat, you have to shout, you have to talk to them closer so that they can be able to hear you.
True.
So these are the majority of people. So in terms of degrees of hearing loss.
Wow.
Yes. And then now when we talk about hearing loss and deafness, the words are almost synonymous.
Okay.
Hearing loss and basically hearing loss and deafness. Hearing loss comes in a little bit medical.
Okay.
But when you talk about deafness, I think the community understands it. It's a language that they understand. But it has a deeper meaning when you talk about deafness. Because, for instance, in medical, when you say you're deaf, it means that your hearing loss is quite profound.
It's on the profound grade because you move from mild, moderate, severe, and profound.
Yes.
So deafness is at the profound level.
The profound level.
Yes.
And these are people who now even speech issues, especially if you develop deafness before birth. Yes.
Okay.
Yes.
All right. So we are saying that hearing loss, basically when we think about hearing loss, you only think about the ear. You know, the general understanding there out there in the community is, I want to believe, is that you think about the ear, so maybe I'll develop a hearing loss because there's a foreign body, because there's just some infection in my ear. We don't see that is a whole spectrum of a journey, and from the way sound is received, the way it's perceived. I'm so excited and amazed. You hear through the brain, up to the brain, all that could be causation for this.
And the reason why I say we hear through the brain is you will see sometimes some conditions, what we call auditory processing conditions, like children with autism, children with hyperactive disorders. They have a perfect, nice peripheral hearing.
Yes.
But the problem is their coordination in the brain.
Yes.
You know, the brain fires from all angles.
Yes.
It fires quite fast.
Yes.
They become inattentive.
Yes.
And therefore, even if signal comes in, they are not able to assimilate and work on that signal. And that is how it's a very good way of defining that we hear through the brain.
Yes. Absolutely. And then, just before, because we're just about to go for a break, the next few minutes, when you talk about hearing loss, and I know we are going to be coming to the causes round probably after the break, actually after the break, yes. Who is more affected?
Yes.
Is it the children, or maybe you can just give a statement through there? Is it the children, or is it the adults?
Yeah.
Yes.
So in the statistics that we have, we say 80% of people with hearing loss are people above 80 years of age.
Above 80 years of age. 80%.
Yes,
all
80%.
Right. Yes.
Although now the statistics is starting to change because we are realizing young people, especially between 16 and 34 years of age, are starting to develop hearing loss.
Yes.
And the reason is because of the interaction with sound, where we have a lot of noise-induced hearing loss.
Yes.
Either due to excessive or loud sounds,
Yes.
excessive use of headphones and
Exactly.
earphones and so that and so on. So this is another big group of people that are now getting affected with hearing loss. The reason why the aged get a lot of hearing loss is the fact that there's a lot of degeneration of the cochlea part.
Or the cochlear part.
Yes.
As they age and as, basically the normal, process of aging.
Yes.
Would we call it wear and tear? Is there something like that? In terms of that would be extreme.
That would be extreme. I
That would
think
be
it's
extreme.
just the fact that age in itself, it's a lot of generation. We can simply say it's wear and tear.
All right.
Yes.
All right.
Yeah.
Now, just another one more question. When you because you have been in this clinical practice, for quite some time now. According to you, which percentage or what proportion is bigger? The proportion that realize they have hearing loss, or the ones that were told by other people that they are not able to hear?
So, that is really a nice, tricky question because people, if in our community, it's the people around us who tells us that you have a hearing problem.
Right.
Unlike us, we basically what we call rehabilitate.
Yes.
We cope up with the problems.
Yes.
Issues that we have, many problems. Sometimes we just cope up with our problems
Yes.
until the people around us
Yes.
are the ones that will be telling us, I think you don't hear. I think there's a problem. Probably when you take your child to Ushago there,
Yes.
and your grandmother is like, I think when I call your child Asiki,
your baby your boy is stubborn.
yeah, so you see, and then even teachers,
They think so.
Even teachers, they
Yes.
say your child is inattentive, your child is, the grade is going down. I think when I talk to your child can't be able to hear me. And I think the people around us are the ones that sometimes realize that we have a problem. Although ourselves we might have a problem, and like I told you, we might be in denial.
Right.
And or we don't know where to get the services. So it's a very tricky question of where it falls.
Where it falls.
Yes.
But basically you're going to get, individuals falling on both ends. Some
Yes.
have been told,
Yes.
others have realized.
Yes.
And others have realized someone has realized that someone is choking, or they need to increase the volume of their TV,
Yeah.
or someone needs to increase their voice
Yeah.
for them to be able to hear.
And I've seen that even parents being marched to the clinic. I think we talk to our dads, he can't hear us, we have to shout,
Yes.
but he says he's okay.
He's okay.
And those again, the stigma issue, because
Yes,
people
stigma
don't
issues.
want hearing
Yes,
it, they don't
yes.
want to be treated.
Yes.
Yeah.
All right.
Yeah.
Our viewers, if you're just joining us, we're discussing hearing loss, and we are glad we have Isaac Wahome, who is an audiologist. Don't touch that dial. Don't move from there. We are saying the hearing ear and the seeing eye, God has made them both, and we must take care of them. See you shortly after the break. Bye.
Are you passionate about performing arts? Are you an actor, actress, narrator, poet, or script writer? This is the biggest break you have been waiting for. Kipaji Festival 2021 presents an amazing opportunity to showcase your gift in acting, narrating, and poetry. This will be an opportune time and season to elevate the gospel through performing arts. To register for the auditions, you have to belong to a sound recognized church, and you can register for a play, narrative, or poetry. For more details on the registration, call 0729 666688. 0729 666688. Registration closes on 7th March 2021. Kipaji Festival, elevating Christian performing arts, powered by Elevate TV.
It was on 13th of March 2013. A gang of 20 men came into the house. They wanted they said they wanted Collins Odhiambo. So I was like, why do you want him? They just stay out of this, we just want him.
It is well. It is well. It is not a very easy place to be. Being that your own child will have to grow up without a father, and you will have to stand in as a father and as a mother. It is a difficult place to be.
Welcome back, viewers. This is Health Up. I hope and I trust you're having a good evening, wherever you're catching us from, whether from FB Live or any of our social media platforms or even Elevate TV. We welcome you back. We're discussing today on a very interesting topic, which is hearing loss and understanding. It's just basically an overview of this because it's a global problem and it's one of the leading causes of disability. And we are getting very informed, and we have our guest who is really informed about these matters, and we trust and we want to believe that this is beneficial to all of us. Now, Isaac Wahome, who is an audiologist, is our guest this evening, and we are glad, sir, that you found time to just be with us. Now, before we went on a break, we just discussed, you told me that's a very tricky, good question, how we diagnose hearing loss, whether people tell us, or is actually us who basically know, and we have delved into that. Now, moving further into this, we would want to know, are there, because when you discuss hearing loss, you first of all took us through the normal. We were taught in school, and our teachers kept telling us, a good teacher is the one who teaches from the known to the unknown. So basically, you brought us from the known, on what is normal, what is physiological, about how hearing occurs. And that was quite a journey, from the way the outer structure, which is called the pinnae, up to the brain, how all that information is received, interpreted, perceived, and all that, and an action is taken. Now, having talked about that, are there probably some types, or do we classify hearing loss in some way? Because that was quite something that when you expounded that. Yes.
Yeah. So definitely when we talk about types of hearing loss, in medical, we usually classify them into three main categories. One of them is the conductive hearing loss. So
conductive hearing loss.
Yes. Conductive hearing loss is anything that interferes with sound, the mechanical transmission of sound. So we are talking about things, for example, like wax, like foreign bodies in the ear, patients who have a perforated eardrum, or a discharging ear from a perforated eardrum, or just middle ear fluid. In medical, we call that otitis media with effusion. Or even just fixed those ossicles, the small bones, when they are dislodged, or when they are fixed. So those are factors that interferes with the mechanical conduction of acoustic energy. So whatever factor that interferes with that is what we call as conductive hearing loss.
And what I hear you, sorry, Dr. to cut you short, what I hear you say, when you talk about conductive, because you're talking about mechanical transmission, it therefore means there's sort of a conduit from when the sound is received, towards where you talked about the middle ear, there's sort of a passage. Because when you say mechanical, it still means something is moving along. So this wax is along, this passage. I think it has a medical name for that. So whatever obstruct there is what you're going to be calling conductive deafness, or some inflammations or diseases of the middle ear causing that.
Perfect.
Right.
So I mean, like it's self-explanatory.
Right. Yes.
Because what happens is that sound comes in form of waves.
Yes.
And that's how it goes inside the canal. So the outer part of the ear basically funnels. It's like a funnel, and channels sounds to a very tiny hole that is called the ear canal.